insight now on the debate over healthcare. Joining us from our Washington bureau is Congressman John Delaney, Democrat from Maryland. Thank you for joining us, Congressman. There's a lot, I'm sure, that your constituents find unpalatable about this report. What is the most egregious part of the CBO scoring to you?
Well, I think the most egregious part is that 14 million Americans will lose health care immediately. And if you think about the lives affected, the people affected, the families affected, I think, it's arguably an immoral thing to do. So I think it's striking the scale of the losses that will occur. And then across time, that number is going to go to 24 million. And these are very consistent with estimates people have put forth when they've thought about this or analyzed this plan. And the criticisms of CBO are completely inappropriate. I mean, CBO is nonpartisan. They do their really good work. The head of the CBO was appointed by Mr. Ryan, Speaker Ryan, so he's a Republican. And to try to undermine the credibility of the CBO, I think is very damaging and very dangerous.
Well, let's assume that there are certain, errors in here and that there's room for error, okay?
Of course.
Still, let's talk about the $337 billion that's going to be saved, according to the report, over time. What damage on the other sort of side of the ledger could that help to repair?
So $337 billion is obviously a very big number, but to put it's $100 per American per year over 10 years. That's the savings associated with dropping 24 million people from health care, right? So if you cut off the poor, if you deprive 24 million people of health care, if you limit Medicaid, of course you're going to save money. That's just a mathematical equation. If we eliminated Medicare, we would save an enormous amount of money. So it's not surprising that the bill scores to have a savings, particularly when you look at the scale of the coverage that is denied and taken away under this bill.
What would be the minimum that Democrats would accept in order to go along with this bill?
I think what Democrats we tried to do for a long time is to fix the problems with the Affordable Care Act. Look, at health care is 1/6 of the U.S. economy. We shouldn't think we're going to reform it in a transformative way and not have to fix it over time. And that was ultimately the problem with what happened with the Affordable Care Act. We transformed 1/6 of the U.S. economy, and then we got into this ideological kind of stalemate where we couldn't make the fixes. A lot of things about the Affordable Care Act are working. The cost of health care as a percentage of our economy has gone down. Medicaid expansion has been very successful. Having things like pre-existing conditions, allowing children to stay on their family plans, very successful. The individual market, which is a relatively small percentage of the health care in this country, is what's flawed. And the problem there is there's not enough young, healthy people, and the insurance companies were not able to charge sufficiently for some of the older people in the plans, people who are not quite at Medicare.
We understand that there were problems with Obamacare, but what do you want this to show in terms of fixes in order to vote for it?
So what we would like to do is fix the problems that are associated with the individual marketplace, right? Because I think if you fix those problems, then you'd have individual marketplaces that are healthy, and then the system would work much better. We don't want to throw the baby out with the bathwater, which is effectively what this bill does.
Well, the time might have come, and gone for fixes, given that this legislation is now in the hands of the Republicans, and looks like if they can get their acts together on it, then it might pass. What have Democrats been talking about together? What have the huddling sessions been dealing with? How are you going to go on the attack or the defense regarding this legislation?
Well, I think we're just going to point out to the American people and to our colleagues on the other side of the aisle the flaws with this proposal. The fact that 14 million people lose health care right away. The fact that 24 million people will lose health care across time. I think we're going to ask our colleagues when we point out these facts, this is a really test of your character. Do you want to vote on this just for political reasons? I mean, the problem with what's happening... So
you're going to rely on the midterm argument. You will lose in the midterms if you...
I think it's something more important than that. I mean, I think we have to think about 24 million human beings. Right? There's a political aspect to this, obviously, but I'm much more focused on the 24 million people, who will lose their health care because of this bill. And I think people will, across time, when people look back at this decision, they're going to say, you were so focused on a repeal that you did something to hurt 24 million people, as opposed to rolling up your sleeves and trying to fix the system that we currently have.
So if the fear of not getting reelected doesn't solve this problem for the Democrats, then, what will you do in order to sort of fight this for your own constituents should it pass this year?
I think we're going to the American people and we're pointing out the problems with this. We're pointing out that there's a better way, which is to fix the system we have now. And we want the American people, look, a lot can happen between election days. And if enough people come out, if enough people contact their member of Congress, their senator, and say, why are you doing this? Why are you jamming something through that hurts so many people? Why don't you go back to the drawing board and try to come up with a proposal, hopefully a bipartisan proposal, but at a minimum a proposal that addresses some of the concerns that have been clearly raised by this CBO report. Come back with a proposal that is consistent with the promises that President Trump made, which is that no one would lose their health care, right? Because this clearly doesn't do that by any means. This is not consistent with the promises that the president made. So I think we're going to the American people. We're pointing out what's wrong with this. The CBO report is obviously a great, nonpartisan piece of evidence to show that we've been correct in our analysis of this bill. And we want them to reach out to their members of Congress and tell them that they don't want their government to do this to so many of their fellow citizens. They want them to go back to the drawing board and come up with a better proposal.
Congressman John Delaney joining us.